पूछोगे भी आप?
नहीं नहीं साइलेंट आनी चाहिए slide you can slide
Just like that?
I'm Dr. Parvinder Kaur Chawla. Today you are reminding me I am going to tell you उसी के साथ to vaccinate or to not to vaccinate. Big question.
Solo होता है. Okay. So, hello, good evening. I'm Dr. Parvinder Chawla from Fortis Hospital, Mohali. And today on World Immunization Day, I'm here to talk about this common thing called vaccination or immunization, and the debate that is often ongoing in our heads and in our clinics as to should we vaccinate a particular patient or not to vaccinate. I'm going to talk about very, very, very basic stuff. And in case there are more questions, then please feel free to and we can have more talks on this topic down the line, and which is very close to my heart. So vaccination, all of us have we've seen and we are aware that in children, vaccinations are something which form part and parcel of early days, and parents are often eager to get their children vaccinated as they are told by their pediatricians. So I link this particular thing as a role model, I would say. And just to put a corollary, this is like having फुटवेयर, जैसे जूते पहनते हैं, so सारे बच्चे पहनते हैं, so it's something like that probably childhood vaccination is something that everybody gets to get during as per the recommended schedule. Adult vaccination, on the other hand, is something which the concept is yet to catch up. People are yet to learn the importance of adult vaccines. And to put a similar corollary, it is something like, जैसे हम बारिश में जाते हैं, we take an umbrella. It is not mandatory to take an umbrella. You may decide to just walk in the rain, or you may decide to have a car right at your doorstep, jump into it, and then reach your destination without getting wet in the rain. So in the similar concept, जो adults में vaccine है, वो एक छाते का काम करती हैं, which we can argue that किसी को छाता चाहिए, किसी को मर्जी है तो ना भी ले. But vaccines form that safety cover, that just like an umbrella prevents the person from getting wet in the rain, the vaccine will protect that person from getting a particular infection or a severe form of that infection if that person is vaccinated. A common example that we often see is कि flu vaccine चाहिए कि नहीं चाहिए. So if those who are vaccinated, the chances of them getting the infection go down, the chances of them getting a severe infection go down. So it is not to say that अगर vaccine लगी होगी, the chances of infection will be completely zero. Just like if you take an umbrella, the chances of getting wet is not zero, but it is markedly decreased. So similarly, a vaccine taken timely will prevent the chances of a severe infection or the infection completely whatsoever. As an example, another example would be the HPV vaccine, the human papilloma virus vaccine, which now we suggest that all teenagers, girls and boys, they get it during the teenage years, and the intent is to prevent that person from getting the cervical cancer down the line. Now, often we see some parents debating or discussing that in our context, what is the risk? So will that child be needed or not? So it is an extension. The safety net provided by vaccine is much, much better than taking the risk of not getting vaccinated. थोड़ा और आगे चल के देखें तो in adults or in elderly population, one vaccine which has now come up and is very, very effective is the herpes zoster vaccine. shingles is something which happens in adults or in elderly when the immunity tends to wane off. The normal immunity of the person tends to decrease with increasing age. And when that happens, that is when the chickenpox virus, which during childhood would have entered the body and sort of settled into a nidus, that sort of reactivates and it causes what is called the herpes zoster, or in local language that is called genio. So this can be very painful infection. It can be sight-threatening infection if it involves the eye or the skin around the eye. So this is something which can be prevented by the vaccine, because vaccine helps to teach the body to how to fight against this virus should it try to get reactivated. So this vaccine serves as something like a walking stick or a lathi, which otherwise in elderly people, we would say that as the age advances, the body's ability to sort of maintain balance and to walk without support, that would decrease. So similarly, this vaccine gives that advantage of the body not succumbing to or not getting affected by reactivation of this virus. And this is strongly indicated in those above the age of 60 years. So इसमें ये लोग argue कर सकते हैं कि I will lead such a life that I will not need a walking stick or a lathi ever in my life. Yes. So if somebody is very proactive, exercises well, eats well, is completely healthy, then probably that small subset will not need a walking stick at all life. But for the majority of the population, if the body's internal strength tends to decrease with time, taking a walking stick or a lathi is nothing. There's nothing wrong in that. So similarly, this vaccine, specifically talking about herpes zoster vaccine or the pneumonia vaccine that is available for the elderly population. So this vaccine helps to augment the immunity and to protect these infections harming the adult or the elderly population should they be exposed to these particular organisms. I'm specifically talking about pneumonia and herpes zoster in this context. So अलग अलग उम्र के लिए, अलग अलग सिचुएशंस के लिए, अलग अलग रिस्क फैक्टर्स के लिए, there are different subset of vaccines which are indicated. And I would strongly urge that if you are a patient, do discuss these things with your doctor whenever you visit them. And if you are by chance a physician or a doctor listening to this talk, do be proactive to understand more about the vaccines which are now available, which are indicated for your patient, and to proactively suggest these vaccines to your patient. Many studies have shown that if the doctor understands the need and is able to communicate this need to the patient is very likely to take it. However, if the doctor is not aware, then the patient's reluctance in taking these vaccines. And both ways, there are a number of myths or misconceptions which are available about the vaccines, which are spoken about the vaccines. And the commonest ones are that they are given for many of the diseases which are no longer there. It's not they are not there, it's that we do not see them as often. आज से 50 साल पहले जितना हम पोलियो देखते थे, today we don't see. And the result is because of the vaccine. There's no any other reason for this disease decreasing over the last years. So similarly, we do not see so much of measles out here. Again, that is because the incidence has decreased because of the vaccine. In those areas where the reluctance to take the vaccine increases, we have seen a resurgence or coming back of this deadly disease called measles. So it's not that the diseases are not there, it is that they are being kept under control by the vaccines that are already being administered. Second misconception that often is heard of is that we cannot give too many vaccines together to the patient at the same time, because that will overpower the body's immunity. So this is a complete myth or misconception. ऐसा कुछ नहीं है. Rather 6, 7, 10 any number of antigens or any number of vaccines can be given at the same time, and the body will mount a good amount of immune response to all these antigens simultaneously. Body की ability बहुत ज़्यादा है as compared to the number of vaccines that we are presently giving or recommending. एक और myth मानी जाती है कि natural infection में भी बेहतर है vaccine induced immunity से. So this is wrong. The natural infection, yes, the duration of immunity can be long in some, but the risk involved in natural infection is many times much more than the risk involved with the vaccine. As an example, जैसे measles vaccine से brain infection की बात की जाती है, measles infection से, so वो 1 in 1000 में ऐसा हो सकता है. पर जब हम वैक्सीन देते हैं तो मीजल्स वैक्सीन से ब्रेन की दिक्कत इज लाइक लेस देन वंस इन अ मिलियन. सो वैक्सीन protects much more than the harm that it may cause in a very small number of patients. But human mindset is such that usually we see the harm. So these are the common myths that we see around vaccines. एक और myth देखी जाती है that people think that vaccine will cause the infection it is intended to prevent. We saw this with COVID, with many people thinking that the COVID vaccine can cause COVID. We hear this myth when it comes to flu, कि flu vaccine लगाई तो उसके बाद flu हो गया. Again, these are not even live vaccines. These are not even they do not contain the live viruses per se. So there is absolutely no way in which this vaccine, there are some live vaccines, but these specifically ones that I've spoken about, they cannot cause the infection. And the live vaccines, we do have some of them, especially like chickenpox and the MMR. So these live vaccines, we take utmost care in not giving them to those who have low immunity. But otherwise, for those who have good immunity, they are safe and they are effective and they are much more useful than having to go through the illness per se. So I would like to end with saying that this is one thing or one scientific development that has played a very huge role in taking us where we are today. And vaccines, I mean, ultimately to take a vaccine or not to take a vaccine would be an individual's decision. No vaccine can be forced upon any person, but it will be a good idea to have a dialogue or a talk between a doctor and a patient to decide which are the ones which are needed for you, which are helpful for you, and then to take a conscious call as to take them or not to take them. So I would like to end today's talk here, but I'll be happy to talk more about any specific vaccine in case a request or a query comes down the line. Thank you.